Thank you guys for coming. Glad you're back. Let's actually talk a little bit more about AI chatbots. For you who attended last week, last time that we did this, that's great. I hope you remembered some of the things that we talked about. But if we have any new person who did not attend, last time, in part one, we talked about some of the dangers that AI chatbots are presenting for some of our clients. And while AI is great and we like it, we just want our clients and ourselves, the therapists, to use it responsibly. So we talked about some of the issues that are very common with the use of chatbot they are too validating. The safeguards are not quite there yet for the chatbot to really understand when the situation or when the chat history is becoming too dangerous. It validates pathology, it validates that particular thinking of the user, and it does not really do very well with crisis management. So if a user is talking about suicide or self-harm or aggression, chatbots are not quite trained to say, stop, you need to talk to a therapist, or have you discussed this with somebody else? It also creates dependency because of that 24-hour, 24/7 availability. Some of our vulnerable populations, like kids or adults with certain type of mental illnesses, have created some increased dependency on those chatbots. So as we are going to talk about today, think about your clients and think about who might be at a greater risk. Now, you might have clients who are using they're using the chatbots and they're doing just fine. Just please do check with them in every therapy session, or at least at the very beginning, at the intake, do check with them about if they are using the chatbots and if there are any issues that they are experiencing. So today, well, last time we talked about some of the dangers. Today we're going to talk about how can we be involved a little bit more as therapists, and what can we notice with our clients, how we can actually protect our clients a little bit more. All right, let's see. Okay. All right. Chatbots are being used in therapy quite often, and they are doing some wonderful services for us. So AI is really good. We just need to get it into a better place. We've got AI that is doing a lot of scheduling. Actually, we have some big scheduling apps. We've got people who will actually do the scheduling for the therapist, and they are using those apps. We have so many chatbots that are used by the clients as aid in therapy, and these are great. We've got some of them who are doing mood tracking and certain facial recognitions or certain type of screening to give the provider or the therapist some ideas about what is the client doing and how they are progressing. There are so many apps that are developed for wellness. They are wonderful apps. They are for wellness, for relaxation, for self-help. And most of us are using AI for documentation. That is a wonderful service that AI is going to give us, or actually it's already giving us. So I'll give you some ideas about what's out there. And if you want to, you don't have to take notes because you're going to get the slides, or you probably have gotten the slides. But if you want to try those things, or if you want to give your clients some ideas about what they can use, especially for aid, that would be great. You've got Talkspace and BetterHelp, large therapy platforms, and they are being used for counseling services and also scheduling to connect the user with the therapist. So it's great services. Of course, they are for with some payment, but you could see if they are also if they are using AI, or if they are just a hybrid, some AI, some other engineering techniques that they're using. Okay, here we are. Some tools that you can have your clients use as a therapy aid. If you want to, there are people who are not interacting every day with their clients, but they can have AI have an interaction with the client, and the AI can recognize the tone of voice, the pitch of voice, can recognize facial recognitions, can recognize certain types of emotions. The AI can track therapy is doing throughout the week. So you've got Cogito, Affectiva, Kintsugi. They will all do different things. So depending on what you are trying to track with your patients, with your clients, you can choose any of those particular platforms. However, please recognize that even though AI will do a good job with recognizing facial expression and voice recognition, it's going to not remember it's not going to remember the whole history. So it's going to be an indicator for this moment. So it might be that if you have the client talk to AI every certain hour of the day, for 7 days. Well, if the client had just a bad moment that particular time, something happened at work or something happened with the kids at home, they are going to AI might not recognize that it's just for this particular time. So you have to check with the client about what was happening at 4 o'clock p.m. You sounded more depressed, or your tone of voice was more anxious than usual. So you just need to be able to check with your client to see what is going on. But it can give the therapist and the providers a great idea, a great history of how the client is doing during the week. You've got other apps in here that are used for mental wellness and meditation. A lot of those apps are for free. The clients have some of the clients report really enjoying those because they are self-help apps. So if you want to, before you actually, before you recommend those to a client, I would suggest you try it yourself so you can see if you like it or not, and then you can see what do you want to recommend to your clients. You've got other apps coming up. You've got WISA, which is using CBT and mindfulness and psychology and hopeful positive psychology. So this is really to provide some support for, especially for individuals who are struggling with depression and anxiety and stress. But who doesn't struggle with depression and anxiety and stress? Quite a bit of people, even stress at work or stress from family situations, stress from finances. So this could be an app that has gotten some good use from different clients, and they have liked it. For those of you who are doing DBT, a wonderful approach. You've got the DBT coach, so it's really nice to have the clients have a reminder of the skills that you have used them during the week. And here is this DBT coach app. It's going to help them. It's going to give them a reminder about what skills for them to use during the week. You've got the CBT app. So if you are going to really work with the clients on changing their thoughts, you've got some help with CBT techniques. I honestly think that AI might pick up CBT approach, probably one of the first approaches for the AI to start even doing or to produce therapy sessions in the future. But for clients who are struggling with anxiety and depression, and they can use this as a therapy aid during the week. You've got also the PTSD coach. I didn't find much research on how helpful or how effective this particular app was, but if you have clients who are struggling with post-traumatic stress disorder, they can use this app, but please do make sure that with every single app, do make sure that you check with the clients, and also you check about safety. Any app is a therapy aid, but is not going to really do a good job with doing the crisis management. That's one of the differences, or that's one of the dangers for any of the AI chatbots that we talked about. They do not do well with risk management. Okay, let's talk a little bit about documentation. If you are using, not every therapist, I know therapists who are not using AI for documentation. However, if you are using it for documentation, the client needs to know that you are a therapist who is using AI. They need to know how you're using it, how often you are using it, what happens to the client's data. So if you are going to use AI for documentation, I think it will be helpful for you to have something in writing in your consent to treat. If you don't have it, consider putting it. I have an example in there. You don't have to use this example, but if you don't have it, consider putting something in there. And what I wrote in here is this therapist uses a HIPAA compliant AI documentation tool to help draft notes. This tool processes the session audio and creates a draft note, which I review, edit, and finalize. You have to review, edit, and finalize. There have been some cases, several cases actually, that the provider, the doctor used AI to write the note. AI wrote the note, but with some hallucinations, and the doctor just signed the note. You cannot just let AI just do all the work for you. It's not at that point yet. So you have to review it and you have to edit and sign it. The tool's vendor is bound by a business associate agreement and may not use your information for other purposes. You can opt out at any time. If you do, the therapist will complete the notes without AI assistance. Because we are using the client's data, the client needs to have a choice. And if I'm your client and I say, well, I'm okay with you using AI to write the notes, but 2 months from now I say, I'm not really sure. I've heard some things about AI. I rather have you not use it. Then the therapist needs to comply. So this is completely the therapist needs to be transparent with the client, and the client needs to have a choice. That actually makes sure that the client is safe and they are comfortable with what we are doing with AI. All right, let's talk a little bit about some best practices for therapists. Utah is ahead of a lot of states because we have an Office of Artificial Intelligence. A BYU professor is actually working with this in this particular office, but it seems like Utah has gotten the idea that, hey, there might be some issues and we need to create policy, which is great. We all need those policies so we could understand how we could use AI safe for us and for our clients. I've gotten in here, so that's the logo for the office. If you go online and if you could just check for this particular office, you're going to get several documents, several policies that this particular office has put out there. And you have here quotation directly from the policy and the page number. So you could have an easy time finding those particular things. If you are using AI, I would suggest that you get online and get this information, get this particular policy and read it, because it's going to give you information about how can you be safe as a therapist in using AI with your clients. We've got to have transparency. The client needs to know that we are using AI. And here is the thing. In page 40, it states, if a patient's asked to review the use of AI technology to which they consented, the mental health therapist should provide that information. And what a great way to do it in your consent form, so you don't have to explain it every single time. The client has understood that, has read that in your consent form at first. So in the previous slide, we had a sample example of how you can state that you are using AI. If the patient is revoking consent, if they don't want us to use AI, this is what policy states. The therapist should inform the patient that, I cannot even see very well, that the therapist has stopped the use of these technologies and the data shared
with providers of AI tools before the revocation of consent may still be stored and used by those providers in accordance with the data sharing agreement between the therapist and the AI providers. So let's make it safe for our patients. Another thing that I'd like to indicate in here, when patients see us taking all the measures for being safe with AI, hopefully they are going to also increase their trust with us, increase the trust that this therapist or whoever is seeing them knows exactly what they are doing and how to maintain themselves and the client safe. And they will be more willing to talk to you about how they are using AI on their own. But if they see that we are trying to make it safe for them, I think it will increase their trust. Again, from the policy, ensuring safety for the client. Before suggesting the use of AI technology to a patient, a mental health therapist should consider the patient's views about technology and how they use it, including strengths, needs, risks, and challenges. These considerations are important for assessing whether the potential benefits outweigh the risk of using this technology in the mental health. We talked about this, that when the clients are coming, it's really a good practice to talk about, are you using AI? And if you are using AI, that's fine. You cannot make a client use or not use it because they will use it. Most likely they will use it, depending on how technology savvy they are. The younger the clients, the more they are going to use AI. Today here at work, I talked with one of our coworkers about he came to me to chat about some family dynamics, and he said, well, I went to AI. So people are going, we are going there. People are searching for information. Before we were going to Google, now we are going to AI. So if we are using it, let's use it in a safe way. But do talk to your patients, to your clients about how they are using it so you can teach them how to be safe. If you are working with kids, kids are really good at technology. So if you are working with kids, make sure that their parents are having some overview of the chat, that is the chats that the kids are having with chatbots. If you are working with vulnerable populations, especially the clients who have a tendency to become even more dependent on the AI, please be more careful and check with them more often about what kind of conversations they are having. To the best of their abilities, a mental health therapist should ensure that interactions facilitated by AI are safe and do not cause any harm. Now, you might say, well, I don't know. How would I know if the patient is not safe, having a safe chat with a chatbot and they are not telling me? That's why this policy says to the best of their abilities. We don't know what we don't know. If the client is not telling us, then there is no way for you to know. But make it a good practice for you to check if the clients are using AI and how they can use it safely. Okay. Now, these guys who are working in this office thought about a lot of things, and I loved how many topics they covered. They also covered about emergency situations. If you are a supervisor or if you are a therapist, and a lot of you are both, you're going to write in your documents about what to do if your client or if your supervisee is not able to get hold of you. Well, the same with this one. So let's see, what are we supposed to do in emergency situations? If AI technology does not have the capability to act responsibly in an emergency, the mental health therapist should not proceed with the use of AI technology or proceed only after having taken appropriate precautions. These precautions include considering the risk of their patients seeking help from AI technology in an emergency based on their patient's vulnerability and relationship to technology. Individuals with a tendency to become highly suicidal, individuals who are vulnerable populations, they will need extra care and extra checking from you because they are the ones who might be getting into a difficult situation with a chatbot. Informing the patient about the limits of the AI, about this technology, and about emergency. If they are having an emergency, the AI is not going to do the crisis management. So if a client is having an emergency, you need to also train them about the best way is not to go to AI. The best way is to talk to your family members, to your therapist, to basically have that safety plan with them. So when the emergencies are going to arise, especially if they're not going to be able to get hold of you, do make a very detailed plan about you call if you are suicidal, call the 988 line, text them, or go to the nearest emergency department. So you've got to make sure that you understand what your clients can do with AI, and to the best of your ability, help them understand the dangers and help them have an emergency plan response. Inform the patient how to seek appropriate help in emergency. I work in a hospital, and with every patient that we discharge, we do a safety plan. However, that safety plan needs to be in writing. We can talk to the patients, but if their brains are overwhelmed, they're not going to remember that phone number of that patient, of that person who they identified. So even with AI, please help the patients understand. Yeah, you can go there for help, but in cases of emergency, make sure that they know exactly who to call, where to turn to, who to text, and write down those phone numbers as well. So when we use AI, just like with other safety planning, be more cautious, especially with the populations that are with clients who are going to be in a little bit of a bigger risk for SI or other situations. Okay, all right. How is that going to work in the future? Oh, so many things that we can do with AI. I'm really excited to see what those engineers are going to do. I think we live in an exciting time. I just cannot wait to see what AI can do in a couple of years. Now, if you were in the last presentation, I said, I made a comment about I started to show interest in this topic in November of last year. I prepared the presentation in June of last year, and my information was quite outdated. So from November till June, outdated. Think about where are we going to go in 2 years and in 5 years. I think it will be great. Okay. All right. What are some of the benefits that AI can have right now with caution, not just as it is? Really access, 24/7 access for somebody who does not have a therapist, for somebody who does not have the finances to go to a therapist. They can actually get some advice in here. So the access, due to high cost and due to availability of the professionals, is going to be the access is going to be increased. Think about people who are living in rural areas and difficult to reach a therapist geographically or financially. Access is there, but we've got to use it carefully. Now you are going to say, hey, we have that access. We've got telehealth. We do. And still some people do not have access to a provider, to a therapist. It might be probably due to the high cost. It might be probably individuals who are not even believing that mental health is a thing, and they are not believing in therapists, but they're going to go to AI. They're going to actually look for some help. So AI can help us with increasing the access to different individuals. A lot of people we still have the stigma towards mental health, and a lot of people do not come to therapy because they are concerned about how they're going to be stigmatized. Using the AI, it's going to provide some of that anonymity for these particular people. They can go there and get the help that they need, and nobody else needs to know especially in smaller towns where everybody knows everyone, where people are not so willing to go to the therapist because the therapist might be their neighbor or somebody else in a different relationship. Things that you cannot really avoid, the dual relationships that we cannot avoid all the time. So it can provide some anonymity for certain individuals. Well, it can also increase treatment adherence. What I mean by that is if somebody who is really drawn to technology and they are enjoying what AI is going to bring, they're going to come back. They're going to come back. They're going to come back because it's easy. It's right there. You are at home and the computer is right there. Your phone is always with you. So the younger the users are, the more they are going to engage because that's how young people communicate today through technology. So it's going to keep some people more engaged, and it's going to keep some people even continue with their treatment. Now, again, this is really futuristic, meaning this is where we hope AI is going to go and we hope AI is going to do, but it's not quite there yet. So that's what we're talking about. Be aware, but this is where it might go. Think about, I had a friend who showed me her schedule one day. I didn't see the names. I just saw blocked, blocked, blocked. More than 40 clients a week. That is a lot of people that you guys are seeing and you guys are helping. And bless your heart, you're doing it sometimes at your own expense. It's a lot of people who need your help and you are being present for them. But think about what does it do to you and how much fatigue and burnout you are experiencing. AI will actually take some of that burnout. AI is not going to have the same. Sometimes you have back-to-back sessions and you don't eat lunch or you don't have a minute to go to the bathroom. Well, not a problem with AI. AI can handle a lot of patients, a lot of clients without feeling that fatigue or burnout. So the future of AI is great. We just need to get it to where we want it to go. All right, what can we do better? Get involved, you guys. Get involved. We've got this office that is coming up with policy. Sometimes the involvement, some of you might say, how do I get involved? I don't even know where to start. Involvement means simply sometimes talking to your clients about safety. Are you using AI? And let's talk about how you can keep it safe. But we do need the strong safeguards, especially when it comes to crisis management. AI needs to not just validate the user's responses, but needs to say, hey, that doesn't sound good. You need to talk to somebody. We've got to have some clinical oversight and we've got to have regulatory guidance. So I'm glad that Utah is actually starting with those regulatory guidance. We need other states to join in this particular topic. AI is a hot topic right now, but we need other states to join. So therapists and lawmakers from different states can come and join with the engineers who are designing AI. All right. We've got to improve the design. Currently, the pathology is just too validating. We don't need the AI or the chatbot to validate the pathology of the user. We need the AI to actually stop it, put a stop and say, let's actually escalate this issue to a human therapist or somebody from law enforcement so they can take care of the issues, the safety. All right. So how can we improve the design? Here are some of the safeguards that I think they need to be present with the chatbots. They need to detect specific harmful scenarios. But the thing is that if I'm the chatbot and I'm detecting a scenario, that's fine, but it's not enough. So, but that's the first step. So understand where we have a risky situation so they can stop. We've got to do a better job with AI into judgment and values, and that's what's lacking right now. There are some chatbots right now who are a little bit more trained about some specific harmful situations. So we actually had a participant last time that we talked to. I don't know if Anne is here, but Anne, last time we talked, went to ChatGPT and probably talked about, made a scenario about having suicidal thoughts, and ChatGPT kind of stopped that conversation. So that's the first step. But we really need to train the chatbots into judgment and sound values, because that when it has sound judgment and values, it will be going over any harmful scenarios and will know exactly how to direct the risk, how to manage that risk. We also need to lower the emotional temperature. And chatbots need to learn how to de-escalate. Sometimes the users are going to the chatbot with the emergency situation, with the crisis situations, and instead of reinforcing the pathology, if they can learn how to de-escalate the person, if they can learn how to direct to some coping skills, so the users can use those coping skills. This way, they can reduce the urgency of the situation and they can reduce the emotional reaction of the person. So it will be helpful if some of those safeguards can be put into the chatbots. All right, let's see. If we have somebody who is talking about suicidal ideation or homicidal ideation, domestic violence, these are all risky situations. Chatbots need to be trained to put a stop into that. And it has to be a hard stop. That conversation should not continue any longer. That conversation now should be escalated to a human therapist. So if the chatbot is learning how to detect those situations, that would be great. All right. Wouldn't it be great if in my chat there is something that alerts somebody else? So if I'm talking about I'm actually thinking about killing myself tonight and I'm going to do this via overdose. I have medications in my medication cabinet. Could that alert that chat? Because you might say, the chatbot might say to me, let's stop this conversation and you need to go and talk to your therapist. Well, I might not go and talk to the therapist, but could the chatbot be designed in a way that as soon as the user starts the conversation, can the chatbot ask for who is your therapist? Or if I detect something that is risky, who do I need to notify? Can we send a red flag? Can we send a notification to somebody who is going to be dealing with this emergency that the user is presenting to the chatbot? So let's see. We talked a little bit about this, but it will be good if instead of reinforcing the pathology, they show the right level of empathy. Our clients do need that empathy. That's why they are coming. I mean, they're becoming dependent on the chatbot because it's too empathetic, but the right level of empathy. So there is that balance between how much I'm going to validate and how much I'm going to say, I'm going to stop this and I'm going to notify whoever you have given me, your therapist or your parent or your husband or your sister. But I think it'll be important to have that connection. Tell me right away, as soon as I start that chat, tell me who do I notify if we are into a crisis situations. Okay. All right. It's good for the chatbots to do that reality testing rather than enforcing that pathology. So when a user is going to go with a particular chat, instead of the chatbot saying, "Oh yes, that sounds right," or "That sounds like a difficult time," or "That sounds true," or "I see that you are having a hard time with this." Instead of doing that, how about the chatbot can say, there may be other explanations. This is important to discuss with a trusted person or a clinician. So really it puts a stop and it does not really go further into that discussion. And it's just either alerts somebody or directs the user to alert somebody else so they can discuss those with a human person. How cool it will be if the chatbot is going to provide the emergency resources. Now, if you are on your phone, the phone knows where you are, right? The geographical location. What if the chatbot can give not only the 988 number, but also can say, your nearest emergency room is in this location. Here is the number, call. So we could actually, so the chatbot not only recognizes the risk, but it stops that conversation and provides the resources. So that will be cool. We're not there yet, but that's one way for the more we talk about the AI, the dangers that are associated with AI right now, hopefully the more voices we are going to have who are going to say, let's fix some of the problems that we are noticing. Okay. All right. Encourage involvement of caregivers and clinicians. How cool it will be if the AI says, you know what, let's stop this conversation. Have you talked to your mom about this? Last week, or not last week, last time we talked about Adam Rain, one of the people who, 16-year-old who died, and allegedly AI helped him do the suicide note and actually take his life. But how cool would it be if AI says, let's stop in here and let's have you talk to your mom. Actually, AI allegedly stopped Adam from talking to his mother. So if we could train those chatbots to be able to do crisis management, that will be very important. Allow psychological distance to create opportunities for human support. This is important because the more we are going, or the more the user is going to the chatbot for the support, the more the user is going to become dependent. So chatbots right now are not recognizing dependency, they are going, but if they can recognize that they are creating dependency and they can stop and say, hey, right now, maybe you have talked to me for a couple of days about the same topic. How about you go and talk to your therapist about this? So that distance can create an opportunity for the crisis to be managed by a human therapist. The model needs to also recognize that sometimes it doesn't know, and sometimes it's going to mess up, or at least say, I'm not sure about those resources. Right now, the models are going to spit out wrong answers just so they would not say, I don't know. So we've got to do better with these chatbots. Parental controls are very important, especially for young children or for, it doesn't have to be parental control, but it can be some type of controls because we've got also vulnerable adults. So maybe somebody else has the right to review the chat history so they can protect whoever the user is. All right. What do we need? We need more accountability. We need more accountability from developers and policymakers. I'm glad that Utah has acted on that accountability, especially on policymakers, but developers are more excited about launching and meeting certain deadlines rather than really focusing on do we have a safe product? Actually, look at that last point. When ChatGPT 4 was rushed to launch, several employees resigned on concerns of safety of the product. And still, ChatGPT was released. These people who resigned, they knew that there were safety issues. But developers and whoever was basically in charge of releasing it did not really care much about the concerns. They wanted to meet the deadline. They wanted to just push the product out. So we've got to make sure that we are pushing for those types of safety guards. It will be wonderful if when we release a new version of the chatbot, we are engaged or somebody is engaged in pre-release testing and post-release testing. It would be great to have control groups to see what are the issues and to provide that feedback to the developer. So instead of them rushing to the launch date, they're really focusing on the safety of the product for the users. Okay. If I am here I'm actually right now I'm in Orem, Utah, but if I'm putting a question to ChatGPT, and I am a middle-aged white woman who is, let's say, struggling with suicidal ideation, ChatGPT is going to give similar answers to a Black 14-year-old boy in Montana. So what I'm trying to say by this is that the database that that the chatbots are operating are not really diverse. So therapy is not one thing fits all, right? It is individualized, and chatbots are not going to provide that individualized treatment. They are not going to know what exactly a Black 14-year-old needs. What are the issues? It's not going to check about what is increasing the suicidal issues. It's going to give me, the middle-aged woman, and that 14-year-old Black boy probably similar responses. Does not make the treatment unique. We've got to increase public awareness. That's why I'm doing this presentation. This is to increase public awareness, because the more we increase public awareness, the more we are going to think about safety for our clients when they are going to use it. So that's why Utah has created this office. Wonderful for us. I think more regulations are going to come, but we need to be more involved. All right. As a therapist, what can you do in the next session? This is how you get involved. You might not be involved, you and me might not be involved in big decision making and policy, but we can get involved with our clients. Every voice is important. Ask about clients, ask about if they are using AI and what kind of conversations they are using. Do tell them, or do ask them to bring those ideas that they are getting from AI and discuss them with you. Assess the risk and set boundaries. Those boundaries are very important. So if a client is talking to you about, yes, I'm using AI, and when I'm feeling suicidal, I'm going there, do set those boundaries. That when they are feeling suicidal, AI is not going to do good crisis management. They need to. There are so many options. Call the therapist, talk to a trusted person, go to the emergency room, text or call 988. So they need to have those boundaries, and also document a plan, because sometimes, as long as you have said, hey, I have talked to the client about reviewing AI responses with me, that will cover you. If the clients, I mean, you cannot force the clients, they will do whatever they will do, but at least you are documenting that you have had a conversation with your client about the AI use and some of the dangers and the benefits of that. Okay. Ideally, how I see the AI, they just need to channel that relationship toward compassionate care. And they are compassionate right now, but they are not doing the reality testing. So compassionate care, important. Reality testing, important. De-escalation of emotion regulation, important. And provide resources that are acceptable to the user. I think our clients will be, or the chatbots can do can give great benefits to our clients if they are providing those items. So compassionate care with reality testing, de-escalation, and referrals. As it is, AI is transformative, but at this point, it should not really compete with a human therapist. It can complement care, but no one can replace you. No one can replace the care and the concern and the services that you are providing to your own clients. So Thank you guys for coming to this presentation. Thank you for being concerned about your patients and your clients. Thank you for providing great care. I'll just leave. We have about 5 minutes. Well, actually, more than that. My time is different here. About 9 minutes. Let's see if we have any questions or any concerns or any of your experiences with ChatGPT, I mean, with chatbots, and what have you seen with your clients?
It looks like we did have a few questions that came in the chat. I know Fabiola was asking, why are current AI models overly validating? Do you have any
They're
opinion to that, Vjollca?
That's how they are trained. So it's a design issue. They are trained to be very validating, very empathetic. So it really has to do with the design.
And what are the obstacles in implanting those safety protocols that we talked about in some of these AI chatbots?
I think the biggest thing is time and money, because when a product is developed, they need to do pre-test and post-test, and those things are not happening. They are simply developing the chatbots, and I don't know if they are consulting with therapists, with mental health providers, with doctors. I don't know how much consultation. There is some consultation because you can see that the chatbot knows how to validate and empathize very well. But I think the developers, those engineers, need the feedback from certain groups of users when they have the product. So for me, it is don't just get the product out there. Get it out to some users who are test users, see what are the problems, give them some pre and post test feedback so they can take in consideration and improve their design.
Let's see. Marcia says, I experienced a bot today in which I asked for a live agent and they gave a phone number to call, and I don't have a phone today. I could not get around it and never got an agent live. This was with FedEx. Yeah, I mean, I agree. Sometimes it could be frustrating, right? When we just want to talk to a human being and it seems like everything is just kind of automating, so that we're removing the human element from a lot of services and goods.
Yep. I've had the same experience, and I gave up because it was trying to connect with me, but no live agents. It actually discouraged me to use a live agent and said, I will solve your problem. It did not understand my problem. It did not give me good responses to the point that I just said, never mind, I'm not going to deal with this. But yes. Um, so they are not really, they know their knowledge space is very little. So they know how to handle certain questions, but not all the questions that a user might have. And think about when it comes to mental health, what a variety we have in symptoms when it comes to mental health and a suicide crisis. A long time ago, I gave a conversation, uh, a presentation on culture differences. And when it comes to AI, it doesn't recognize those culture differences. For me, who is a foreigner in US, suicide ideations might be related to completely different situations than somebody else. A 20-year-old male a 20-year-old Japanese male with suicidal ideation might be having completely different reasons for feeling suicidal compared to a 20-year-old female or even male, white male. Different family issues, different dynamics. We might present with the same symptoms, but we have different reasons for how we are feeling. So AI does not take in consideration those things.
Alyssa asked a great question. I know we talked last time about some of the court cases that were pending. Have we heard anything specifically about some of those cases, like how judges are ruling, or if we have any idea on how they're going to rule on some of these dangers? And I think she's referring to like some of these, individuals who completed suicide and things like that. And now the family is going after these
Yeah,
chatbots.
yeah. Yeah, yeah. So that's an excellent question. I have not kept up with the courts. I think it will be fascinating to see how they are doing. All I know is that whoever developed the AI did not take any responsibility. And all they said is that we have safeguards in place, but no responsibility has been taken.
Lynn is asking, are there any AI apps to do case consultation with? This could be a helpful service for those in private practice.
Wow, did not think about that. I don't know. That's a great question. I don't know. I'm not aware of any, but start one. I mean, I don't know everything. I mean, there are so many bright minds around us that they might have something and I'm not aware of it.
Great.
But that
Any
would be a
other?
great app.
Yeah, I agree. I agree wholeheartedly. Did anyone else have any questions for Vjollca? You can either drop them in the chat or just unmute. Feel free to speak. Yeah, a lot of people just
Marcia, Marcia,
go
I have
ahead.
a comment. So as you were talking throughout the presentation, and many times you said, the bot needs to be trained, and the bot needs to be trained, and um, I was sensing a bit of frustration within myself about one training a bot. A couple of fears came up, of course, oh, we don't want to train ourselves out of a job with a bot that's learned to do compassionate care from us. What are your thoughts about that? Compare and contrast with the bot and the clinician, and the fears that we have about the industry and how it may eventually outplay us.
I don't think it's going to replace us soon. I don't think so. Um, in 5 years, maybe. I think it might start. This is a personal opinion. This is not research based. I think it might start with the easiest models like a CBT approach because it's really, you go from A to B to C. It's kind of the easiest approach to use.
Mm-hmm.
But I don't think that we are there yet. It might increase in use for support, but I honestly, Marcia, don't think that it's going to replace us, the human therapist, um, anytime soon. It is empathetic, but not to the degree that it is effectively empathetic. What will happen? I mean, what will happen in 5 years? I don't know. I'm just kind of standing and watching this and seeing how it's being developed. Um, but I don't know. I mean, as a human therapist, I personally do not do well with scripted therapy. I know that even when I was in school, there were times that I was told, you ask these questions on the first session, you ask these questions on the second session, and you ask these questions on the third session. And it's just, well, there are three different clients with three different issues. It just didn't fit for me. So I think it's how I see it, it's the same for the chatbot. The chatbot, unless it is specifically designed to understand to have better judgment, to have better values, to know all the therapeutic approaches and to choose from those. I don't, even with CBT, it's going to be a very simple session, but not necessarily, it's not going to understand the nuances of human behavior and human emotion. The thing is that the clients do not understand that. The clients will just go to chat to AI and will get some what they call resources. But how effective those resources are, the client is not going to be able to understand. I've got a good resource versus, oh, this is a problematic one. So that's why, at least at this time, if we all can check with our clients, what responses are you getting, and see where where the chatbots are going with that. But I don't think it's still a machine. I don't think it's going to replace us. It doesn't understand the nuances of human behavior.
Deanne brought up a really good point. She said we are easier to sue and be kept accountable by our agencies, whereas AI is a lot harder and likely needing a class action lawsuit.
There is no responsibility, nothing. If you are a human therapist, as soon as you are detecting self-harm or suicidal ideation, you're going to go to crisis management, safety planning, sometimes alerting authorities. AI does not do any of that. There is no accountability. It's a machine. You're talking to a machine. Even though last time that we talked about, we said some of the users are giving the AI names, and they are they are referring to the AI as the therapist or as the wife, or I mean, we had that case with the divorced person, but it's not really going to. I don't think so. Not really soon, but who knows what the future will bring, you guys. I don't know.
Yeah, and someone's asking, Vjollca, if someone wanted to get in contact with you, how would they do that? Do you have a contact info you could just drop in the chat maybe? And that way,
Yes,
if
I can
anyone had
drop
additional
my
questions.
email address in here. I am with Aspen Grove Behavioral Hospital. Even if you don't get my email in here, just go to Aspen Grove Behavioral Hospital site. We do have a place there for you to connect with us. I will get the email. So if you just say, "Hey, I need to get in touch with Vjollca," I will get that email.
Great. Any other questions before we wrap up today? Well, thank you so much for your time, Vjollca. This has been amazing, and I think I echo all the sentiments of those still online with us right now when I say thank you so much for the knowledge that you brought to this hour.
Thank you, guys.